The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello, I'm Don McIntosh, and this is Health for a Lifetime. We're glad you've joined us today. Today we're going to be talking about research. Well, wait a minute. Research is a good thing. It's not something that makes us go to sleep. It's something that might document why we go to sleep, but it's something that today I think will wake you up because it's good news research. And joining us to talk about this research is a researcher from Loma Linda University, Dr. John Kelly. He has been a physician since 2000. And actually, you went to school a little bit later in life, didn't you, Dr. Kelly?
Yes, Don. I started school at Loma Linda when I was 48.
48, man. I mean, people out there are probably gasping. Was that planned?
Well, you certainly don't go to medical school by accident. So it was planned. But no, actually, I wanted to go to medical school. First thought about it when I was 28. But I was told I was too old because I had dropped out of college and I needed to go back and do 4 years of college. And I was told, you know, when you're over 30, it's hard to get to medical school. So I spent 20 years doing...
Believing that
and doing health education and getting acquainted with some of God's health principles. And then in 96, I guess God decided it was time to send me to medical school.
So you went through medical school, and not only that, you came out with MPH in epidemiology and research, and you got to be involved in primary research right away.
Yes, that's true. I'm very fortunate, but I also I have a very specific objective in mind. As you know, I didn't get distracted during medical school with lots of. There's so many interesting specialties and things that you learn, but I knew I wanted to do lifestyle medicine. And it fairly quickly was obvious that lifestyle research was something for me. Actually, I started my first research during my last year of residency. In fact, one of the studies we're going to talk about today, I collected the data during my last year of residency.
Is that right? So you knew exactly why you were there, what you were doing, and the Lord had given you just a real laser beam-like focus.
Yes, I knew from the very first day of medical school I wanted to do lifestyle medicine.
You know, this is a great time to be talking about lifestyle medicine. You know, just recently there was a National Geographic article, I believe, that we have a graphic showing that looked at Adventist, and here it is. You brought it with you.
Yes, you see here the Adventist Health Study 2 and the National Geographic, which was focusing on longevity, and I asked the question, is there a connection between these two images? And there certainly is. That National Geographic article is directly an outgrowth of the research that's been done showing the benefits to the lifestyle principles that we have as a people and as a church.
So it was like over the last 20, 30 years that, is this right or wrong, that the Adventist Health Study #1 was being conducted?
Yes.
And it was because of that research that article, like National Geographic, and then many other news networks all over the place were picking up on that. It's because of that research that these articles are able to be published.
That is correct. And there's a number of studies that have, I mean, the medical literature is literally replete now with results from Adventist studies. And we've got the Adventist Health Study 2 is an even larger, bigger study that Dr. Gary Fraser is working the lead principal investigator, and so the lifestyle research in Adventist is just growing and mushrooming.
Now, you know, you mentioned Dr. Fraser, and I think he also recently published a book a couple years ago from Oxford University Press that has a listing of all the different scientific studies that have been done on Seventh-day Adventists. How many is that about?
You know, I have to, I'm deficient. I don't know just how many. I know this. I know personally of 7 or 8 that have been done, but many of those early ones were quite small. And, you know, with research is like anything else. It starts off and grows slowly in magnitude. And so some of those early studies that we did with the American Cancer Society as one of our control groups that we compared Adventist to and so forth, the Adventist mortality study and others were quite small. But now we're doing a study of 125,000 Seventh-day Adventists.
That's huge.
That
now
is
you're involved in what you call the Adventist Lifestyle Intervention Research Project.
That's correct. I don't actually work directly with Dr. Frazier and the team on the Adventist Health Study. I appreciate its work and I value it greatly, but I'm actually trying to building on that research, doing intervention research to test some of the hypotheses. You know, we found out, for example, that those folk who ate more nuts per week had a reduced risk of heart disease. So that could lead to a question, would it be that you could improve your heart disease risk if you were to eat nuts? Now, that may seem like an obvious thing, but in research, those are two different questions. One was an observation that people who ate more nuts had less risk of heart disease. That does not prove that if a person with high risk started eating nuts, it would reduce their risk. But we have, Dr. Sabate, Joan Sabate, has done studies that showed that was the case. So now what we're doing is we're saying, well, let's test many of these other principles, and there's a natural place to study those is at the Adventist lifestyle centers that are using these very principles to treat disease.
So what are some of those principles? Let's talk about where they are, what they're called, and let's just go through that.
Well, let me just do it by talking about the the data that we collected. I mentioned when I was in my last year of residency collecting some data at various lifestyle centers. Let me just mention the Battle Creek Lifestyle Health Center, the Lifestyle Center of America.
That's in Oklahoma.
That's in Oklahoma, thank you. Uchee Pines Institute and Wellness Center, that's in Alabama.
Alabama.
Weimar Institute in California. And Wildwood Hospital and Lifestyle Center in Georgia.
And any of these names, if you put in your search engine on your web thing, it'll come right up.
Yes, they all have internet sites and so forth.
Okay.
I think actually the Battle Creek Lifestyle Health Center, that may be one that has closed. I think that's closed down. But all the others are there and functioning. But so I collected data on patients from 30 or more at each one of those centers. So it's a multi-center study. It's what we technically call a retrospectively collected data, but it was prospective data. In other words, at the time they were collecting the measures on these patients, they did not know they were going to be in a study. And I came along later and collected
what had happened.
Yes, correct. Okay. And now the type of intervention, you asked what do they do? What we found was that there are differences between these 5 centers, okay? But the differences were relatively minor compared to...
Negligible, they're just small.
There were minor differences overall, and we were able to pool all those subjects. So we had 183 subjects that we could put in our study.
That were largely, you say pooling, they were largely being treated the same way, just minor differences.
Right.
And the reason they were being treated the same was why?
Well, they were all receiving the same kind of intervention. Let me just read here what a typical intervention would be at these centers, okay? They all received a plant-based, high-fiber, low-fat, cholesterol-free, calorie-restricted diet. In fact, some of the centers use fasting, especially with diabetics or some other obesity patients.
Do they all exercise?
They all do. That's the second one. They all receive regular graded exercise and strength-building exercise. You're right. They also all use health education classes, cognitive training.
Educate.
Right. And typically that would include knowledge about the physiology of their illness, about the connection between their lifestyle and their disease, knowledge about nutrition and the effect of nutrition, and cooking classes, etc. Yes, stress management. They also then I found they had very similar interventions. They would drinking water At each center, the patients were not only encouraged to drink water, in many of the centers they actually had a simple way, unobtrusively, of counting the amount of water or glasses of water, or giving them containers with the amount of water they were supposed to drink for the day. They had spiritual exercises which were voluntary.
All of them, they were voluntary?
Yes. They would have hydrotherapy treatments, hot and cold for the limbs, for example. I learned something wonderful I'd never seen in a clinical setting before, and that was getting rid of diabetic neuropathy pain by the use of hot and cold contrast to the lower limbs, and it was highly effective. They had massage. They had physician visits on a regular basis. Medications were adjusted. Most of the time, the medications had to be reduced as the lifestyle therapies exerted their effect, and some of them used supplements. That was the one area that varied the most, was
supplements.
Supplements or herbs, this kind of thing.
But everything else was, it was really minor, and so you could pool these all together and have a much larger study than anyone could do on their own.
That's correct. That's correct. It gave us a lot more power to find out what the real effect was.
So what did you find? Or you're going to talk about that a little bit more in the second half, but start on it now. What did you find? Well,
what we found in a nutshell was that we did a case control analysis where we were looking at diabetics. As you know, diabetes is an epidemic and growing worldwide, unfortunately. And the question was, would lifestyle be as effective in a diabetic, or is it less effective? Because after all, they're having problems with lifestyle. So there was a reasonable question. We compared the reduction of cardiac risk in patients that were diabetic to concurrent controls that did not have diabetes. So these were non-diabetic concurrent controls, meaning the controls got the exact same treatment that the diabetic cases did. And we compared them to these two groups and found that the diabetics had as good or better outcomes, risk reduction from lifestyle intervention, as the non-diabetic controls did.
In other words, it works.
And it works, and it works maybe even better in diabetics.
Is that right? So this has been published?
This will be published. It is not yet published. The manuscript I hope to have submitted here shortly.
And that'll be in what they call a peer-reviewed?
Peer-reviewed, yes. One of the major diabetes journals, yes.
And then, if that happens, which we hope it does, that just gives more credibility to some very good things that are happening in lifestyle centers around the nation.
Yes, especially I'm looking, of course, at Adventist lifestyle centers, but we have compared some of the results that we find in the Adventist lifestyle centers to published outcomes from other studies like the DASH diet, which has been recognized for lowering blood pressure, and the portfolio diet, which has been shown to reduce cholesterol. And we made some comparisons to those, which I'll talk about if we have time.
All right. We're talking with Dr. John Kelly. He's a researcher from Loma Linda University, and he is looking at the lifestyle centers around the country that largely are operated by Seventh-day Adventists, and in this particular study, all of them were. Those studies are found in Oklahoma, the Lifestyle Center of America, or Weimar in Northern California, or Uchee Pines in Alabama, Wildwood in Georgia, and there may be others as well. We encourage you to get in touch with these places. They really are helping people, and Dr. Kelly is doing the research that just documents what really is happening. And when we come back, we'll look more closely at what he's been finding. We hope that you can join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Luddington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Luddington have been featured on 3ABN, and in this booklet, They present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. John Kelly. We're talking about research as it relates to lifestyle and avoiding America's killer diseases. And Dr. Kelly, we're just glad that you could join us today.
Thank you, Don. It's good to be here talking about research.
And what you've discovered is that the things that we're learning in the Adventist Health Study, which now have taken a national theater, and the National Institutes of Health are giving a lot of money to study that, $12 million, I believe, this last study. What you're finding is that those same principles, the same things they've learned, really are things that need to be studied on an intervention level. In other words, does it work, in these lifestyle centers that you've mentioned? And you've found some preliminary results that are very encouraging.
Yes. We were just talking about how we compared the effect in folks that have diabetes to concurrent controls, meaning people who were there at the same time but did not have diabetes, and found that the benefits were as great or greater in the diabetics as the non-diabetics. But what I want to talk about next is how we have compared the outcomes from the centers to published results in other studies. You may be aware that Dean Ornish has done some landmark studies on
He's that
heart disease.
famous Harvard-trained cardiologist now living, I think, in California somewhere.
Yes, I understand he's one of President Clinton's physician and friends. So he's a well-known researcher. He's done some of the pioneering work looking at the effect of diet on heart disease, and especially regression of coronary artery blockages.
Okay.
The Lifestyle Heart Trial was first published, its one-year results was published in Lancet in 1990.
Which is a very reputable magazine.
Probably one of the best in the world. And what he found was that in this study they compared a low-fat diet with stress reduction techniques, meditation techniques that were used to the recommended, at the time, the standard of care for dietary recommendations for a person who had heart disease.
So in other words, the American Heart.
Yeah, the step 1, step 2
diet.
Mm-hmm. And what he found at 1 year was that there was about 0.4 risk. In other words, it was a tremendous risk reduction, less than half the risk of events, heart attack or other angina, chest pain in the treatment group compared to the controls that were getting standard care. But probably the most amazing thing was when they looked at the blockages, where we can do an angiogram, we can do an image of the heart vessels, and we can see
if it's narrowed or
right.
not.
We can see what's called the lumen, the opening where the blood flows, and see the blockage. And this is what most people that have ever had a stent, they've got one of these done, and it showed this real narrow spot, and the doctor put a piece of metal in there, right? Okay. Well, they did these studies before and after, and found that even though the radiologists were blinded, they did not know
who was who.
They found that there was a significant difference in this, that on the control group, the blockages were actually continuing to get worse. Mm-hmm. Their disease was continuing to progress.
And these were the ones on normal medication and normal American Heart diet.
Yes, 30% of calories from fat or less and so forth. The treatment group, which was on the low fat, 10% or less of the calories from fat, which is quite low, and exercise and meditation and stress reduction, group support, etc. This group had an actual reversal. The blockages were going away.
Wow, so this is more powerful than the normal treatment you normally would hear about.
Oh my goodness, it absolutely. And not only that, what was amazing to a lot of folk was that in the treatment group, they were not on medication. And so, of course, this was an unusual study. These were people who, of course, agreed to this intervention. Sometimes I ask folk, well, would you be willing to do that? Well, ahead of time, we might say, I'm not so sure, but now looking back, you would want to be in that treatment group because the 5-year results were published in 1998 in the Journal of American Medical Association, and they showed that there was a almost 28% worsening of the blockage. They were getting worse, 28% worse in the control group, but in the treatment group, they had reversed by almost 8%. They had opened up by about 8% in 5 years.
So lifestyle intervention is much more effective than the traditional approaches, is what you're finding.
That's what he showed clearly. And there have been others. Dr. Caldwell Esselstyn Jr. has done some work on using diet and lifestyle to treat coronary artery disease with similar results, and so has John McDougall. There's a number of doctors that have done this work and actually had even studies of the flow of the blood to the heart. I mean, this is an objective measure, and this is not just looking at did your cholesterol go down, but did the blockages open up or not.
Same thing's true, I think, of the CHIP program. They have some studies showing
Yes, I understand. Hans Diehl's Coronary Health Improvement Project, that has been documented to improve circulation of the blood to the heart. With the modern techniques we have, we can actually look at and see how well the heart muscle is being perfused with blood, and we can see a significant difference from these lifestyle programs.
You had another study as well looking at diet that you want to...
Yes, you know, there was an amazing study published by Dr. David Jenkins. He's head of endocrinology at the University of Toronto. And this was published, I believe, in 2003 in the Journal of American Medical Association. What he did was he took a group of patients that had very high cholesterol, what we call hyperlipidemics, cholesterol over 250, and he put, this was a randomized trial. He put about half of the, he puts one group on a diet that was, he called it the portfolio diet because it consisted of pieces of things that had been shown in the literature to reduce cholesterol.
I see.
Soy, protein, viscous fiber, almonds, etc. So he called it a portfolio. And another group, he put on lovastatin, 20 milligrams a day. This is a typical starting dose, as you may know, for a statin which lowers cholesterol.
That's the drug you get from your doctor when you have high cholesterol,
yes.
right? Okay.
That's one of the older ones. You might not get lovastatin these days, but it's about similar as the others. Then there was a third group, was a control group, and they had no change. They didn't get any special intervention. And what we found was, what he found was that there was a highly significant reduction in cholesterol in two groups, the lovastatin and the portfolio diet. Both reduced cholesterol.
Which was more?
Well, the one that seemed to be a little bit more may have been the lovastatin. Depends on what numbers you look at, the LDL versus the ratio, etc. But what he did find was there was no statistically significant difference between the portfolio diet without medication or the lovastatin without diet. So what this is telling us is that his study showed that lifestyle
is as strong as a statin.
Diet alone can be as effective as a beginning dose of a statin. And I'm excited because a number of studies are being done continually now showing that lifestyle intervention is as or more effective than medication for many of these diseases.
So you're planning to put all these studies, you know, you've reviewed the literature, it's obvious, and you've reviewed one on heart disease, you've reviewed one on diet here, and what you're hoping to show, or maybe a scientist wouldn't say that, what you expect to find, perhaps, you'll be surprised if you don't, is that these lifestyle centers will be just as effective as a statin, and even more effective when you look at the side effects.
Yes, in fact, what we've done, I've taken that same data that we got from these 5 centers I mentioned earlier, and we have looked at the results from those subjects, comparing them to these published results.
Is that right?
Yes, and what we found is that really the lifestyle intervention is as effective as these published studies are showing. So in other words, we don't just think this, we have some objective data, some objective analyses to indicate that yes, the typical patient going through a lifestyle center is having as good or better risk reductions as those that are in these published studies. What we want to do is we want to now do a longer term prospective longitudinal study. In other words, these are looking at three-week results, okay?
Mm-hmm. Right,
and
month long.
Yeah,
right.
And so we need to look at what happens at 1 year, 5 years, just like Dean Ornish study did.
And that will then document that not only are they effective in the short term, but also in the long term. Do you expect to find a difference in those groups between those that respond to the spiritual component versus those that do not?
Well, you know, Don, I'm actually very excited at what we will find and looking to ferret out what are the predictors of who does well and stays with the program versus who doesn't. One of the things that Dean Ornish showed in his study was that, you know, there was a regression in only 82% of the subjects in the question of
in other words, reversal
yes.
of whatever.
So I asked myself, well, why didn't everybody? And he showed that the amount of regression correlated to the adherence to the program.
I see.
The greater that they followed the program, the greater the regression. So yes, you're right. It'll be very interesting to see if there's a predictor, and what is the predictor? Many of us think that it will be those who take their personal health as a steward, looking at themselves as a steward,
spiritually,
as opposed to an owner.
And do you have that in your study that you're planning? Do you have those kind of questions so you can look at that spiritual component?
Yes, we will definitely be doing spiritual history, if you will, or spiritual measures. We'll be looking at a lot of things. We'll be looking at depression, for example. It's been thought that perhaps depression factors may play into this. We'll be looking at spirituality. Be looking at their attitude, the change in the attitude itself.
Mm-hmm.
I mean, we probably are going to find things that we don't even anticipate.
Right. You know, I've always wanted someone to do the very study that you're doing, and I really believe that that's a study for this time. I mean, I have said, as in my church and other churches around the nation are now becoming more energized and trying to be kind of lifestyle centers themselves, churches, that really what I've seen anecdotally is those people that make the spiritual connection really have more effective results in the long haul. And I'm really gratified. You told me that church leaders are really endorsing what you're doing. Mark Finley, a well-known Adventist evangelist, and others are really, backing this up. Thank you so much for joining us today.
Thank you, Don, and I appreciate being here.
And thank you for joining us on Health for a Lifetime. Man, there's good news out there, and it may be just as close as your nearest Seventh-day Adventist church. Check them out. Check a lifestyle out, and you'll have health that lasts for a lifetime.